This is an important inaugural event that will support a system-wide understanding of health equity. I'd like to thank the department's Diversity Committee for hosting the event and give special thanks to the co-chairs, Sandy Goodwin and Sharon Davis Murdoch. You folks are doing a tremendous job. I'd also like to thank those from here and from far away who are sharing their expertise and live experience to increase our understanding of health inequities and factors that affect our health. I appreciate your willingness to share ideas of working together to address the needs. I also want to welcome the representatives from my own department who are here, as well as our partners from the community and academia. It's really great to have such a diverse group in this room. This morning, you have been talking about the impact of inequities on the mental health of two key populations, immigrants and refugees, and people in the Pride community. This afternoon, you are learning more about Q&As and a quiz and from the presentations of equity in the workplace. Nova Scotia's cultural competence guidelines are the first in Canada and help ensure the delivery of better health care for all Nova Scotians and their families. The guideline prompts workers in all areas of health to consider and respond to the history and lived experience of all those we serve. It also means we identify the disparities and pay close attention to the special needs of health care delivery according to the nation of origin, level of ability, gender, sexual orientation, gender identity, race, ethnicity, social economic status, and religious affiliation. I think it's also important to recognize that we that work in the healthcare field are dealing with people at times of discomfort for them, of times of when they feel the most vulnerable. And we as healthcare workers are the only ones that can give them the support at that time to help them to work through our system. And those of you that work in health know that it's a very complex system. And it's even complex for those of us that work in it. I mean, even from my office trying to find some answers some days, so guess being a patient, trying to figure out how you get through it must be quite burdensome. But I appreciate that events like this will help us all come together to better serve the people that need it. Understanding and recognizing who we are and where we are on bridging the gaps in health equity is essential to delivering on the vision and mission of the Department of Health and Wellness, generations of Nova Scotians living well. As part of our department, we've tried to raise diversity within it, and one way we've tried to recognize it is moving Sharon Murdoch Davis to our senior leadership team so she can make sure that that is on the agenda at all our meetings. Diversity is who we are. Together is how we work. Thank you for providing that by attending this first equity forum, and have a great afternoon. Thank you very much.